So, safety in treating anger and the notion of what is healthy anger. It's something that can get very politicized, very tangled into other agendas. And so I'm wanting to very specifically make it clear that being right and being healthy are two different things. You can be totally right and having a stroke. You can be totally right and acting out in ways that are very regrettable. You can be totally right and collapsed in a small heap on the floor. I'm not discussing whether or not you're right. It's not, I say, not our job, actually, to discuss whether or not somebody's right about what they're right about. We can affirm if we want to. You're onto something there. But it's important not to be discrediting a viewpoint based on how somebody is metabolizing their rage and moving with their rage. I'm saying this just because I come from a tradition which sometimes misuses the word appropriate and inappropriate in terms of, is this anger appropriate or inappropriate? And then we judge that way. And this can be very difficult when interacting with the anger of somebody who is living a different demographic than you are. You really might not have any idea if you are a white person treating an African American in Baltimore, if you are a man treating a woman, if you are a cisgendered woman treating a differently gendered person. There's all kinds of places where we honestly may not be able to make that judgment call. And that it's really worth, therefore, kind of stepping out of the judge box and just sitting down beside the person to ask the question around health, not is this healthy or unhealthy, but what is this anger healthier than? And then what would be the next most healthy step for this anger process? This may be a different way of looking at things than we're used to, but the exact same anger may be today healthier than where we were at yesterday. But anger, because it's the wood element, is a moving target. What's healthy today needs to evolve, needs to move, needs to become its own next step, needs to not stagnate. So we are always looking at, in order to get a sense of what is this person's trajectory, because it's not all one trajectory. In this person's trajectory, what is this anger healthier than? You might even want to try it on yourself at the moment. Feel for places in you where you might be angry. And before climbing up on top of it with judgment to decide whether it's appropriate or healthy, unhealthy, yes, no, check box. Put some hands on your body and feel for, what is my anger healthier than? I mean, I know in me I can think of, well, it's healthier than putting up with some really dumb shit. Right? It's healthier than curling up in a ball and letting them keep kicking. It's healthier than being so scared that I run and can't look at what's going on. Healthier than writing a lot of sad songs for the whole rest of your life and not doing anything to change things. I'm sure we can be creative about this and sometimes ask our clients it if it's not obvious. It's a really nice thing to ask an angry person, especially an angry person of a different demographic than your own. Tell me a little bit about what your anger is healthier than. What is this a next step up from? So that you can really feel, it's like, okay, this is lifting me out of despair, or okay, this is lifting me out of passivity, or this is bolstering my self-esteem to the point where I can get out of bed in the morning and even make myself look nice. We don't know until we ask. The person we ask may not know until we ask, because we are in a fairly anger-shaming culture. Again, for some demographics than others. And to give somebody a chance to feel for, what is my anger healthier than? And to feel that accomplishment it's like it puts a piton in your rock climb. It's like, let's just put the pitons, like when you put that like in the cliff wall. Now you can hang on that. Okay. Made it this far, no small task. Once we have a sense of what this anger is healthier than, we have a little bit of a trajectory. And we have more capacity to feel for, okay, and what would the next step be for the evolution of this anger, which is endless. It's a long way down, it's a long way up for that tree. There's something in Chinese medicine called the Confucian transformations of virtue that speak of each of the elements and each of the emotions as an initial disturbance that gets us on a road to somewhere, to someplace even better than health. Namely, they call it virtue, but it's not prissy. It's sagely engagement with life, such that the ways in which it's really, really hard turn out to be worth it. That's not a prissy thing. That's something that's like, let's go for health and even further. Because sometimes, certainly at the end of a life, we aren't usually in health on some level, but we may be in virtue. So it's worth aiming far. The virtue to which anger is bringing us, Ren, shows the character of a person and the number 2. To understand this, try widen your gaze so that you're seeing more than the computer, and close one eye and see what you see with just one eye. Then without moving your head, switch to the other eye and see what you see. Let's switch back and forth a couple times. Noticing the difference. It's not a big difference. Your eyes are pretty close together, but it's different, yeah? In East Asian medicine, one eye can see, but it takes 2 eyes to have vision. Because there's depth perception. There's perspective. Person 2. And the difference between what your left eye sees and what your right eye sees is different for a very specific reason. Your left eye is seeing from where your left eye is located. Your right eye is seeing from where your right eye is located. I see from where I stand. All I can do is see from where I stand. You see from where you stand. All you can see is from where you stand. But that's not perspective. That's not perspective. Perspective, vision, comes when we are 2-eyed. When I'm looking at you and you're looking at me, and we are taking into account what can only be seen from where the other one is standing. So where we're aiming our road, the road that we're on when we are angry, is towards something that is much, much more sophisticated than being right. Being right is often very one-eyed. One eye, it's like, yeah, this is what I see from where I stand, and I do see it from where I stand. It's a good starting point. It's healthier than not seeing it and not calling it. It's really important. Where we're headed is, can I, without losing my stand, what I'm standing for, what I see, can I also hear from someone else who's standing somewhere else and seeing something else, and neither collapse nor kill them, so as to begin the dialectical process of saying, what the heck are we going to do? It's a long road. And what we are working with when we are treating anger is helping a person to be in the best physiological, emotional, mental, and spiritual state to be able to go into that creative, visionary place that goes beyond being right to finding actual, practical, livable, creative solutions. It's not a one jump. But that's where we're aiming when we're speaking about healthier or less healthy than. And people come in very different parts of this journey towards two-eyed creative vision. They may come in very, very collapsed in their own point of view, really discouraged and discredited within themselves, in which case getting a bit of a roar is going to be healthier. They may be very, very confident in their viewpoint and be very my way or the highway about it, and not have space for the other eye. What healthier looks like for that person is going to be different than what it looks like for the more crushed person. And again, taking a moment, please, to extend mercy to yourself as being a person who is on a road with anger, who's on a road, who's been somewhere, and is headed somewhere. And where you are right now, that's a stage of the journey. It's healthier than fill in the blank, you name it. And once we've actually acknowledged that and settled into it, the conversation about what's healthier than this can begin to open.